I started getting cramps like 3 months before my period. Horrendous cramping, and my mom thought I was getting my period then, but I didn't. But then through like 3 months later, I got my period, and I bled for like 30 days straight.
I remember one incident where she was in the bathroom and she was crying, and this must have been about 3 years ago, and she started shouting for her mother, and her mother went and opened the door, and she was literally on the floor rolling in pain. She was in so much pain, and Beth and I decided something is really wrong here, something is seriously wrong. Of course, we took her to the emergency that night, but we could see it was a start of something that would develop into what we know today.
Endo is pain. That's all I could get out of it.
You live it, you breathe it, it's every day. Every day she hurts, every day.
I never understood pain until I had to have daily pain. I developed constant lower abdominal pain, and also developed right upper quadrant pain. And it became progressively worse with each cycle, to the point where I was seeing patients and I was doubled over in pain.
It just feels like somebody's pulling your insides. There's days where, I lay in bed crying, and I force myself to get up and, go to work, and I'm in pain, at work, and it's hard, it's difficult.
The pain affects everything. It makes you miss things in your life that are important. Events, going out with friends, being there at family functions, just being able to get up and take care of your house, to walk your dog. Things people take for granted that you can do. The pain is so debilitating. There's times I've crawled across the floor.
It's unbearable, completely unbearable, where it totally affects everything around you, your life, your work, your relationship, your friendships. It's a lot.
Your emotional state really is affected by endometriosis, because when you are not able to do the things that you like to do or you want to do because you're crippled up in pain, or you're bleeding so heavy that you're afraid to leave your house, it's quite a struggle.
You see her go from doctor to doctor to doctor with this prescription, with that prescription, with this, with that, never coming up with anything, again, a name for the disease or a name for what's wrong with her, what's causing all the pain.
That's been a major problem in my life. The doctor is saying it's in your head, you're making all this up.
I think it was like 4 or 5 doctors I went through before someone actually listened to me, like actually knew or somewhat understood what it was, or from the symptoms.
People tell you it's all in your head, you don't have that pain, but how can they tell you that when it's your body that's having the pain?
They'd always ask me, oh, how are your periods? Do you have a lot of cramping? And I would say, yes, I have a lot of pain. Yes, I have awful bleeding. And none of the doctors I've ever seen suggested that maybe they should look into this a little bit more to try to find out what was causing these problems.
I was told I had polycystic ovarian disease,
Venereal diseases, kidney infections, liver infections. They started treating her for constipation.
I went to a different doctor, and she said I was too young for endometriosis.
Some of them said this is just a woman thing and you need to put up with it.
They checked every organ in my body. I know what was wrong with me. Then they sent me to a gastro something specialist, thinking it has something to do with my bowel, and he's like, oh yeah, you've got, bowel problems, blah, 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 and gave me pills.
I was told that I had a hormone imbalance.
From the urologist to the family doctor to the gastroenterologist, okay, then we said, well, let's try the OBGYN.
I mean, a lot of the doctors wanted to give me antidepressants, and I'm like, I'm not depressed. I am sick. I'm in pain.
One of the problems that we identified early on by talking to a lot of women with endometriosis and by carrying out the research was that diagnosis was a real problem. And we found that the women were delaying going to the physician, and our research, again published with the NIH, showed that the average woman or girl was delaying going to the physician at all for at least 4.5 years. And then on top of that, the physician was delaying again for 4.5 to 5 years, so that, as we published with the NIH, the average delay from onset of symptoms to diagnosis was a whopping 10 years.
When I was 14, I started my first period, and moving to California almost 10 years later, then finally I was diagnosed.
I had endometriosis. I was full of it. I had adhesions all over. I was upset because this should have been caught sooner, and I feel now that I suffered for a long time needlessly.
So often by the time the disease is diagnosed, it's intractable. That makes your job as a physician so much more difficult. By the time we realize she has the disease, she's full of scar tissue, adhesions, inflammation. The immune system has just run amok.
All those years, all those drugs, all those treatments, missing out on so much in high school. So much I always wanted to be involved in so much. Sports, I love sports. I didn't get to do any of that. All the different activities I had to miss out on because of it.
No wonder I couldn't walk. No wonder I couldn't go to the bathroom. No, I couldn't move or sleep in bed comfortably, let alone be with the person that you love and sexually be together. There's no intimacy. How can you do that when you can't even move?
When you find that your partner at any given day or time, or even during the act of sex, would have excruciating pain, it always weighs on your mind, because if you care for the individual, you don't want them to go experience pain for something that you think is enjoyable.
It affects your life inside and out, whether it's physically, emotionally, financially. It affects a woman's life.
Through research that we funded, a blood test to diagnose endometriosis is available. And it is so simple that you simply take a blood test. We won't have to go to a laparoscopy until we know already that we have a very, very high chance of endometriosis in that young girl or woman. So that solves a lot of problems for us. As a parent myself, I can understand why parents of teenagers and girls younger than that don't want to go in for a laparoscopy, but if they know there is a disease there and is a problem, and that you, the physician who have really educated yourself and trained yourself to be an expert surgeon, are ready to go in there and start treating it, I think that we will move to much more treatment for endometriosis and many more women and girls being diagnosed.
Just because a patient is sitting there and isn't moaning in pain does not mean that they don't have severe, severe pain that can be affecting their life, that can be affecting their relationships, that can be affecting their jobs, their futures. I think you need to ask a teenage girl who comes to you complaining of pelvic pain or complaining of severe menstrual cramps if she has dyspareunia, if she has pain with intercourse, if she has pain when she has a bowel movement, if she has diarrhea or vomiting with her period, if she, these are symptoms that they will not volunteer. And I think if you ask the right questions, it's really not that difficult to make a clinical diagnosis of endometriosis.
I love the type of doctors that will sit you in their office first and talk to you and ask you questions, thorough questions about everything in your life, your symptoms. Then after they're talking to you and asking questions, do you have any questions? I love it when they ask me, do I have any questions? And really listen to see what it is that my concerns, and work with me with that. I've dealt with so many doctors who didn't do that.
We know our bodies more than anyone else, and this is real. It's real pain. and it needs to be resolved. I mean, doctors need to be involved in it more, because women are just still to this day, here it is 20 years later, 25 years later, and women are still being misdiagnosed.